Bismillahirrahmanirrahim. Optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. Assalamu alaikum. My name is Dr. MOMENA and I'm here to present the topic of dynamics of disease transmission under kind supervision of my supervisor, Professor Dr. Sairab sir. Learning outlines will be epidemiological triad, modes of transmission, disease outbreak, related terminologies, epidemic, endemic, pandemic, susceptibility versus immunity, herd immunity, incubation period, outbreak investigation. By the end of this discussion, participants will be able to define the concepts that are related to disease transmission using epidemiological research approach to communicable disease as a model. They will be able to define important terms related to the occurrence of a disease in population, including attack rate, how to calculate an attack rate, how to describe the steps in an outbreak investigation, and solve MCQs. The dynamics of disease transmission involve understanding how disease spread within population and the factors that influence the spread of this disease. It results from an interaction of host, a person, the agent, a bacteria, and the environment. For example, polluted air. Although some diseases are largely genetic in origin, virtually all diseases they result from an interaction of genetic, behavioral, and environmental factors, with the proportions different for different. Disease has been classically described as the result of the epidemiological triad, medical mode of infectious disease. It is also known as medical model of infectious disease. It is the product of an interaction of human host, an infectious or other type of agent, and the environment that promotes the exposure. This is the diagrammatic representation of the epidemiological triad, which shows the interaction between host factors, agent factors, and environmental factors leading to a particular disease. Among host factors, age, gender, occupation, pregnancy, personal habits are included. Agent factors, virulence, viral load. Environmental factors, comorbs, confined location, climate, geographical variations, and secondary infections are included. This is another example which shows the chain of infection. At first, we have this infectious agent, which can be a bacteria or a virus or a parasite. So this chain of infection model, it is a conceptual framework that illustrates how infectious diseases they spread from one host to another. It consists of several key components, each representing a stage in the transmission process. So the breakdown of the model is pathogen, the infectious agent, bacteria, virus, fungus, parasite, which is responsible for causing the disease. Moving on to reservoir, which is the natural habitat where the pathogen lives and multiplies. This can be a human, animal, or environment, for example, soil, water. Then there is portal of exit, the route through which the pathogen leaves the reservoir. This can include a respiratory secretion, blood, body fluids, or other pathways. Moving on to the mode of transmission. The method by which the pathogen is transmitted to a new host, this can be direct, person-to-person contact, or indirect by surface, air, vectors like mosquitoes. Then moving on to the portal of entry, the route through which the pathogen enters the new host. Common portals include respiratory tracts, broken skin, or mucous membrane. And this enters into a vulnerable host. A vulnerable host is that individual who is vulnerable to infection due to the lack of immunity, any age factor, health status, or any other factor. Public health interventions, they aim to interrupt this chain at any point. Strategies can include vaccination, sanitation, hygiene, and health education. So this model is crucial for developing effective disease prevention and control, and we will be studying reservoir, mode of transmission, and vulnerability of a host in detail in the next few slides. Moving on to modes of transmission, how a disease spreads. It has various ways. One is direct transmission, in which the spread of pathogens through direct contact between an infected individual and a susceptible host. The examples include person to person and skin contact. Person to person contact, for example, respiratory droplets in case of influenza or COVID-19, skin contact, for example, in case of herpes virus. Second type is indirect transmission, in which pathogens they spread via the intermediary object or vector. Some of the types are airborne transmission. Pathogens are suspended in the air and then they enter into the susceptible host. For example, tuberculosis. The vector-borne transmission, it spreads through vectors like mosquitoes or ticks, for example, malaria and Lyme disease. For transmission, contaminated surfaces or objects, they are responsible for spreading this pathogen to a vulnerable host. For example, norovirus on doorknobs. Moving on, continuing with this modes of transmission, there is this zoonotic transmission, diseases that are transmitted from animals to humans. Examples include direct contact handling infected animals, for example, rabies, or foodborne, which is consumption of undercooked animal products, for example, salmonella. One other type is vertical transmission, in which the pathogens are transmitted from mother to child during pregnancy, childbirth, or breastfeeding. Examples include the congenital infections, Zika virus, and syphilis. So these are the factors that are associated with the increased risk of human disease. These are host factors, or known as intrinsic factors, agents, or environmental factors. Host factors are age, gender, ethnicity, religion, customs, occupation, hereditary, marital status, family background, previous disease. Agents, bacteria, chemical poisons, alcohol, smoke, physical factors, auto-radiation, fire, nutrition, lack or excess. Environmental factors or extrinsic factors include temperature, humidity, altitude, crowding, housing, neighborhood, water, milk, food, radiation, air pollution, and noise. Moving on to the outbreak of a disease, we will be discussing certain related terminologies. Endemic, epidemic, pandemic. What are these? We will be discussing these. Outbreak, it is a sudden increase in the number of cases of a disease in a specific area or among a specific group. It can be localized, for example, within a community or larger. Endemic is defined as the habitual presence of a disease within a given geographical area. It may also refer to the usual occurrence of a given disease within such an area, sometimes referred to as the background rate of a disease. Epidemic is defined as the occurrence in a community or a region of a group of illness of similar nature, clearly in excess of normal expectancy and derived from a common or a propagated source. Pandemic, it refers to a worldwide epidemic. So further characteristics, they are compared in this table, in which we see first one, epidemic. The short term and can fluctuate widely based on various factors. In case of endemic, it has a stable incidence, long-term and stable presence over time. Whereas in case of pandemic, the pandemic can last for an extended period of time, varying from months to years. The cause of an epidemic, it can be triggered by various factors, including environmental changes, introduction of a new pathogen, or changes in population immunity. However, in case of an endemic, a local transmission is often limited to specific regions, for example, malaria in certain tropical areas. In pandemic, it typically involves a new infectious agent or strain to which the general population has little or no immunity. Examples of an epidemic include certain outbreaks of disease like flu, measles, or cholera. Endemic example, malaria in sub-Saharan Africa, chickenpox in US in the absence of vaccination, and pandemic, the COVID-19 pandemic. Impact of epidemic on health system. It puts a strain on health system as hospitals may become overwhelmed with patients. Public health response. Quick actions like vaccination campaigns, quarantine measures, and public awareness efforts, they're often implemented. In case of an endemic, public health strategies, they focus mainly on the long-term management and prevention of the disease in the population. Public health education on prevention and early detection, economic and social effects, regular healthcare costs, and community health initiatives, they are mostly taken. In case of a pandemic, the implementation of the widespread testing, contact tracing, quarantine measures, development and distribution of vaccines and treatment, public health campaigns, to educate the public, for example, in case of COVID-19, mask wearing, hand hygiene, sanitization, they were implemented. Disruption of the daily life, economy, and well-being occurs along with pandemic. These are some of the characteristics of epidemic, endemic, and pandemic. Moving on to this certain other terminology that is related to an outbreak is sporadic outbreak, which is the occasional case of a disease occurring irregularly in a population or area, not following a predictable pattern. Then moving on to the incidence, which shows the new number of cases of a disease that occur in a specified population during a defined period of time. Prevalence is the total number of the existing cases, which includes new and pre-existing cases of a disease in a population at a given time. Now, what is a reservoir? The natural habitat or host where a pathogen lives, grows, and multiplies is known as a reservoir. For example, it can be an animal, it can be a human, or it can be the environment like water or soil. Now, what is a pathogen? It is an organism like virus, bacteria, fungus, or parasite that causes the disease in a susceptible host. Vector, an organism, often an insect, that transmits a pathogen from one host to another. For example, mosquitoes, they are transmitting malaria. Case. A case, it refers to an individual who is diagnosed with a specific disease or condition. This person exhibits symptoms or has laboratory confirmed evidence of the disease. A primary case or the index case, it is the first individual identified in an outbreak who is diagnosed with the disease. This person is often the source of infection for subsequent cases. A secondary case is any individual who becomes infected as a result of contact with a primary case. These cases, they arise from transmission of disease from the primary case. Quarantine is the practice of isolating individuals who may have been exposed to a contagious disease to prevent its spread. Now, moving on to clinical and subclinical disease. The clinical disease is a condition where the symptoms of a disease, they are noticeable and the disease can be diagnosed based on clinical signs and history of the patient. The characteristics of a clinical disease are patient experience observable signs, for example, fever, pain, myalgias, fatigue. Diagnosis can often be through physical examination or lab tests or imaging. Examples include acute and chronic stages of clinical diseases. Acute, influenza and pneumonia, and in case of chronic, there are diabetes and hypertension. The impact of a clinical disease is it generally leads to medical attention and intervention. Subclinical disease is a state where the disease is present but not causing noticeable symptoms. It may be identified through screening or diagnostic tests. Now, the characteristics are symptoms, no apparent clinical signs, individuals may feel healthy. The diagnosis is through laboratory tests, screening or monitoring of biomarkers. Example include hepatitis B infection, where individuals may not show symptoms but can still spread the virus. Chronic conditions, elevated blood pressure that hasn't yet led to the noticeable symptoms or the earliest stages of developing a blood pressure. Impact, it can contribute to the disease spread, progression, and complications without the individuals being aware of it. Now, what is a carrier? It is an individual who harbors the organism but is not infected as measured by serological testing. No evidence of an antibody response is there or shows no evidence of clinical illness. This person can still infect others, although the infectivity is generally lower than with other infections. Classification of a carrier is, it can be a temporary carrier or it can be a chronic carrier. Temporary carrier status may be for a limited duration of time, and in case of chronic, they'll be lasting for months or years, as in case of typhoid, Mary, for salmonella type. Other types are incubatory carrier, convalescent carrier, and healthy carrier. Incubatory carrier is an individual who is in the incubation period of a disease. During this time, they have been infected with a pathogen but do not yet show symptoms. A convalescent carrier is an individual who has recovered from a disease but continues to harbor the pathogens and can still transmit it to the others. A healthy carrier or asymptomatic carrier is an individual who is infected with a pathogen but does not exhibit any symptoms of disease at any time. Now, what makes a host susceptible to infection? The amount of disease in a population depends on a balance between the number of people in that population who are susceptible or at risk for the disease and the number of people who are not susceptible or immune and therefore not at risk. They may be immune because they have had these previously and have antibodies, which we call as active immunity, or because they have been immunized before by vaccination, which is known as passive immunity. They also may not be susceptible on a genetic base. Clearly, if the entire population is immune, no epidemic can develop, but the balance is usually struck somewhere in between immunity and susceptibility, and when it moves towards susceptibility, the likelihood of an outbreak increases. Innate immunity. It is the body's first line of defense against pathogen and is present from birth. It provides immediate, non-specific protection and plays a crucial role in the immune response, and it consists of physical barriers like skin, chemical barriers like saliva and other body fluids, cellular defense like phagocytes and natural killer cells, also known as NK cells, inflammatory cells, and complement system of coagulation. So this was innate immunity. Another immunity that we acquire over time during life is known as acquired immunity or the adaptive immunity, which is further divided into active immunity and passive immunity. This active immunity is developed after being exposed to an infection or after getting a vaccine, or passive immunity in which the immunity you acquire from someone or something else, like the natural way of antibodies transmitting from mother to baby by milk. Artificial is antibodies acquired from an immune serum medicine. Active immunity has also two types of natural and artificial antibodies. In case of natural, antibodies they made after exposure to an infection, and artificial is antibodies made after getting a vaccination. So this active immunity has certain parts. It consists of humoral immunity or cellular immunity. The humoral immunity, it shows that in the presence of an extracellular antigen, the B cells present in the plasma, they identify it, combine with it, and either they convert into a long-term memory B cell or they form the short-lived plasma cell, which forms antibodies. This long-term memory B cell remembers the antigen and on the re-exposure of the similar antigen will produce antibodies. So by these antibodies, they combat this infectious agent. So this blocks the viral particles or any other pathogenic particles from infecting cells. In case of cellular immunity, the T cells, which are the T helper cells, okay, these they are involved in interacting with the antigen, foreign antigen, and they combine with it. And the cytotoxic T cells, they are important in the apoptosis of cells. So the T cells, they are mediating the cellular immunity, which is further contributing to the active immunity of an individual. Now, the passive immunity mostly consists of immunoglobulins. There are 5 types of immunoglobulins: IgA, IgD, IgE, IgG, and IgM. A short overview of these antibodies are: IgA is secreted into mucus, saliva, tears, colostrum, tags pathogens for destruction. IgD is the B cell receptor, stimulates the release of IgM. IgE binds to mast cells and basophils, allergy and antiparasitic activity. IgG binds to phagocytes, main blood antibodies for secondary response and as it crosses placenta. IgM fixes complement, main antibody of primary response, B cell receptor, immune system memory. Moving on to another important concept of epidemiology is herd immunity, a concept in epidemiology that refers to the indirect protection from an infectious disease that occurs when a significant portion of a population becomes immune to the disease. Either through vaccination or previous infections, the spread of the disease is slowed or halted, providing protection to those who are not immune. For example, those who cannot be vaccinated, like infants, elder individuals, those with compromised immune system who may not be able to receive vaccines. Each disease has a specific threshold of immunity needed in population to achieve herd immunity. This threshold varies depending on factors such as the disease contagiousness. For example, the herd immunity for measles may require about 95% of the population to be immune. Now, what is the importance of herd immunity? The public health strategy includes achieving herd immunity. It is a crucial goal in controlling and eliminating the infectious diseases within communities. Now, disease eradication, in some cases, high levels of immunity can lead to the eventual eradication of a disease, as seen with smallpox. Certain challenges they're also faced for developing herd immunity. These are the vaccine hesitancy. Most of the people are misinformed and their fear regarding vaccines can lead to lower vaccination rates, hindering the achievement of herd immunity. Emergence of variants. There are new strains of pathogens. They may affect the effectiveness of existing vaccines, requiring updates to vaccination strategies. Now, moving on to incubation period, it is the time between exposure to an infectious agents like virus or bacterium and the appearance of the first symptoms of the disease. Duration, the length of the incubation period, it varies widely depending on specific pathogen and individual's immune response. It can range from a few hours to several years. Examples are influenza, which has 1 to 4 days of incubation period, COVID-19 2 to 14 days of incubation period, HIV, it can be several years before symptoms appear. Clinical implications, it helps in understanding the incubation period. It is essential for diagnosing the disease and managing outbreaks, also helps determining the timing of interventions such as quarantine and contact tracing. Now, the public health considerations regarding the incubation period is infection control, identifying the incubation period. It can guide public health measures, including how long individuals should be monitored after exposure, vaccination timing in some cases. Knowing the incubation period helps in deciding when to vaccinate or boost immunity within a population to prevent outbreaks. Now, there is another concept of median incubation period. It is the time interval between exposure to an infectious agent and the onset of symptoms in half of the affected individuals. It provides a useful measure to understand the typical duration of incubation period for a specific disease. The median can differ from the average. Mean incubation period, especially in diseases with a wide range of incubation times. For example, while the average incubation disease for a disease might be skewed by outliers, the median provides a more reliable indication of what most people can expect. Now, the latent period is the time during which the pathogen is present in host but not yet causing the symptoms, and the individual is not yet capable of transmitting the infection to others. Importance of incubation period is it helps in outbreak investigation. It can trace the source of an outbreak and identify its spread. It helps in identifying the exposure, helps in quarantine and isolation, vaccination timing, symptom onset prediction, differential diagnosis, behavioral changes, and treatment development, and further research in this regard. The serial interval, it is defined as the period between the onset of symptoms in one case, like the primary case, and the onset of symptoms in a secondary case that was infected by primary. Generation time refers to the time it takes for pathogen to reproduce and for the next generation of infectious individuals to become infectious. The communicable period or contagious period, it refers to the time frame during which an infected individual can transmit a pathogen to others. This period is crucial in understanding the spread of infectious diseases and guiding public health intervention. The attack rate. It is also an important epidemiological measure. It is used to assess the frequency of diseases occurrence within a specific population during an outbreak or epidemic. So how to define this? It is the proportion of individuals in a population who become infected by a disease during a defined period of time. It is usually expressed as a percentage of per 1,000 or 100,000 individuals. So the formula is attack rate is equals to number of new cases divided by total population at risk into 100. Now, there are types of attack rates, cumulative attack rate and secondary attack rate. We will be further discussing the secondary attack rate. Cumulative attack rate is the total number of cases over a specified period of time relative to the total population at risk. Secondary attack rate is the proportion of cases among contacts of known cases useful in assessing in the transmissibility of a disease. And it is calculated as number of new cases among contacts, not the population, but among contacts by total number of contacts at risk into 100. Applications. So the secondary attack rate is commonly used in studies of contagious diseases like influenza and measles. It aids in planning vaccination campaigns, isolation measures, and public health messaging, population dynamics. Limitations, the rate can vary based on the nature of the disease, population density, and the susceptibility of the context. Underreporting is also there, incomplete reporting of the cases. Now, how to investigate an outbreak investigation, 10 steps. The first 2 steps comes under the heading of assessing, which shows confirm existence of an outbreak or corroborate diagnosis. Number 3 is define, identify cases, collect data, characterize cases, person, place, and time, develop hypothesis, test hypothesis, verify the biological coherence, communicate results, and write reports, implement control measures. So moving on to the recent advances. Number 1 is the importance, benefits, and future of nanobiosensors for infectious diseases. So the infectious diseases caused by pathogenic microorganisms such as bacteria, virus, parasites, or fungi, they are crucial for efficient disease management, reducing morbidity and mortality rates, and controlling disease spread. Traditional lab-based diagnostic methods face challenges such as high cost. Diagnostic biosensors, they have gained momentum as a potential solution, offering advantages such as low cost, high sensitivity, ease of use, and probability. Nanobiosensors, they are a promising tool for detecting and diagnosing infectious diseases such as coronavirus disease, HIV, and hepatitis. These sensors use nanostructured carbon nanotubes, graphene, and nanoparticles to direct specific biomarkers of pathogens. They operate through mechanisms like the lateral flow test platform, where a sample containing the biomarker or pathogen is applied to a test strip. If present, the sample binds to specific recognition probes on the strip, indicating a positive result. So this finding event is visualized through a colored line. This review discusses the importance, benefits, and potential of nanobiosensors in detecting infectious agents. The other one is impact of human activities on disease spreading mosquitoes in urban areas, which shows urbanization, one of the leading global trends of 21st century that has a significant impact on health. Among health challenges caused by urbanization, the relationship of urbanization between emergence and spread of mosquito-borne infections, it is of great public health concern. Urbanization process encompasses social, economic, environmental changes that directly impact the biology of mosquito species. So all these modifications, they may influence mosquitoes' life history, traits, and their ability to transmit disease. This review aimed to summarize the impact of urbanization and mosquito spreads in urban areas and the risk associated with the emergence of mosquito bite infectious disease. Moreover, mosquitoes are considered as holobions as evidenced by numerous studies. So this review, it also represents an initial synthesis on how human-driven transformations impact microbial communities in larval habitats and further interfere with mosquito behavior and the life cycle in urban areas. MCQs. Number one, a community health worker is monitoring an outbreak of influenza in Lahore. The disease seems to be spreading rapidly across multiple neighborhoods. The health workers notices that cases increases significantly after Eid. Based on scenario, which of the following best describes the mode of transmission for influenza outbreak? A, airborne transmission, B, droplet transmission, C, fomite transmission, D, vector-borne transmission, E, water-borne transmission.
B.
Yes, the correct answer is B. 2. Mayo Hospital infection control team is investigating an outbreak of MRSA among patients in surgical ward. After several cases were identified, they traced the infection source to a staff member who was unknowingly carrying the bacteria. The team also noted that the bacteria, they were often transmitted when staff moved between patients without changing gloves or practicing hand hygiene. So in this scenario, what is the mode of transmission? A, direct contact, B, indirect contact, C, droplet transmission, D, airborne transmission, E, vector-borne transmission. The answer is B, transmission. 3, an outbreak of Lyme disease is reported in a rural community. Public health investigators trace the source to an area with a high population of deer and mice. These animals harbor Borrelia burgdorferi, the bacteria responsible for Lyme's disease, which is then transmitted to humans through tick bites. Interestingly, some community members who work in forested area also found to have been bitten by ticks but show no signs of illness, although they have low levels of bacteria in their blood. So in this scenario, which of the following statements best distinguishes the reservoir from a carrier of Borrelia? A, deer and mice serve as carriers since they transmit the bacteria to ticks while humans are the reservoir. B, ticks are the reservoir since they directly transmit the bacteria to humans while deer and mice are the carriers. C, deer and mice are the reservoir as they naturally harbor the bacteria while the asymptomatic humans exposed to tick act as carriers. D, human bitten by ticks are the reservoir because they harbor bacteria while ticks serve as carriers. E, both humans and deer serve as carriers since neither show signs of illness while the bacteria reservoir is the local environment.
C.
Yes, C is the answer. 4, a health screening program in a large city finds that a significant number of people have antibodies to hepatitis C, even though they have no history of illness or symptoms associated with the infection. Further testing confirms that these individuals have low levels of virus in their blood, but they do not exhibit any clinical signs or symptoms of liver disease. Public health officials are concerned because these individuals could still spread the disease unknowingly. Based on this scenario, which of the following best describes the health status of these individuals? A, they are in incubation period of hepatitis C and will soon show symptoms. B, they have a subclinical infection carrying the virus without symptoms but still potentially contagious. C, they are in the convalescent stage, having recovered from hepatitis C and now immune. D, they are immune carriers, completely resistant to hepatitis C due to prior exposure. E, they have cleared the infection entirely with no risk of transmission to others.
B.
B is the correct answer. A group of friends attends a large outdoor barbecue on a warm summer day. 2 days after the event, one person begins to experience symptoms of food poisoning, including nausea, vomiting, and stomach cramps. Shortly afterwards, several other attendees also report similar symptoms. The health department investigates and suspects salmonella contamination in food. They note that everyone who became ill started showing symptoms between 12 and 72 hours after the barbecue party. In this scenario, what does the incubation period? It refers to A, the time it takes from the symptoms to worsen after the first signs of illness appear, the time between exposure to salmonella and the onset of symptoms, C, the duration of symptoms from beginning to end of illness, D, the period when individuals are contagious and can spread salmonella to others, and E, the time needed for a person to fully recover from salmonella infection. So the answer is yes, B. 6. In a small town, health officials noticed a sudden increase in flu cases, far exceedingly the number of cases expected for this time of year. Within a few weeks, nearby cities report similar spikes in flu cases. The flu continues to spread quickly across multiple countries, and eventually the World Health Organization declares that outbreak has reached many continents, impacting large number of people globally. So, which of the following terms best describes the final stage of this flu outbreak? A. Epidemic. B. Pandemic. C. Endemic. D. Hyperendemic. E. Cluster.
B.
Yes, B. Pandemic.
B.
7. A traveler. A traveler is preparing to visit a country where there is a high risk of exposure to rabies. As a precaution, they receive a series of rabies vaccine to stimulate their immune system to produce antibodies. Meanwhile, another individual is bitten by a potentially rabid animal and is treated with an injection of rabies immunoglobulin, which provides immediate antibodies against the virus. Which of the following statements best distinguishes the type of immunity received by traveler who received the rabies vaccine and the person who received rabies immunoglobulin? A. The traveler received passive immunity because the vaccine provided immediate protection while the bitten individual received active immunity. B. Both individuals received passive immunity as neither was exposed to the live virus directly. C. The traveler received active immunity through vaccination, which stimulates antibody production, while the bitten individual received passive immunity with immediate antibodies. D. Both individuals received active immunity as both were protected from the long-term virus. The traveler received passive immunity through vaccination, while the bitten individual's immunity is active due to exposure to the virus.
C.
C.
The traveler.
C. Yes, C is the correct answer. 8. A student cuts her finger while preparing food in the kitchen. Shortly after, the area around the cut becomes red, swollen, and warm. Despite the lack of any specific pathogen entering the wound, the body responds to injury by activating various immune cells to protect against possible infection and promote healing. Which of the following best describes the type of immunity demonstrated by the body's response to injury? A. Acquired immunity. B. Innate immunity. C. Passive immunity. D. Cell-mediated immunity. And E. Adaptive immunity.
B.
Yes, B. Innate immunity is the answer. 9. In a small community, a local outbreak of chickenpox occurs. During an investigation, it was found that 10 primary cases were identified. These primary cases then transmitted the illness to 30 secondary cases. What is the secondary attack rate for this outbreak?
A.
A is the answer. 10th, a small community has been facing an outbreak of whooping cough pertussis. Public health officials have noticed that vaccination rates in the community have dropped significantly over the past few years. Many parents are hesitant to vaccinate their children due to misinformation about the vaccine safety. As a result, several unvaccinated children have contracted whooping cough, leading to hospitalization. Based on this scenario, what is the most important reason for emphasizing herd immunity in the community? A. Herd immunity will completely eliminate whooping cough from the community, ensuring to one ever get sick. B. Achieving herd immunity will protect only those individuals who are vaccinated from contracting whooping cough. C. High vaccination rates can help protect vulnerable populations such as infants and those with compromised immunity.